and feel free. Yes. So, like I said, since the recording is just starting, my name is Professor Lawson Ekpe. I'm a professor of chemical pathology. I'm going to deliver a lecture, which is the maiden lecture and the very first one for this our tutorials and lecture series. I'm going to make it in such a way that it's going to be as simple as possible, but note your questions so that at the end of the day, if you have them, we can, go through them. So, right, I'm going to talk on the topic overview of pathology. By this lecture, what we want to achieve at the end of the day is to have an understanding what exactly is pathology, what is it all about, and how does it connect to us, how does it relate to us in the area of human health, because all we are doing here is at the end of the day to foster good health for people. So, but then how does pathology come in? What exactly is this pathology all about? So by way of introduction, I'm going to define pathology. Yes, pathology is actually a word, one word, but it comes from two Greek words. The first one is pathos, and the second one is logos. Pathos is actually suffering. Another word pathos can mean is disease. Another word pathos can mean is sickness. So when you say pathos in the Greek word, you're referring to sickness, suffering, or disease. Whereas logos is the study. So study of disease, study of suffering, or study of illnesses. That is the real meaning of the two words combined together to form pathology. So when you say pathology, you are looking at the study in medicine that has to do with diseases. As the name implies, it is actually a discipline in medicine that is devoted to the study of diseases. How that means is that what exactly is this disease? How does this disease start? What are the changes that occurs in this disease? Let me give an example now. If somebody is initially very fine, no problem, no sickness, you say the person is healthy, apparently healthy. But assuming the person goes to a place, he has mosquito bite, and then he has malaria, the next thing you will see him is that his body will be hot, he might start to vomit, and sometimes they may have going to toilet, diarrhea, depending on whether it's an adult or a child. If it's even a child, can have convulsion. So now, all those changes that come from the normal person, we have seen a change of vomiting, which was not there before. We have seen a change of fever, body is hot, which was not there before. We have seen a change of going to toilet or even convulsion, which was not there. All those changes that come as a result of the sickness and the processes by which those changes come is what we call pathogenesis. Pathogenesis. How does the disease start? How does it move? And how does it end? All those changes that occur during a disease process is what the study of pathology is all about. So it is actually a branch of medicine that has to do with the study of diseases and how these diseases affect the body. Because, like if somebody has headache, let's use malaria again. If somebody has malaria and then another person has hepatitis and then another person has cancer, these are three different diseases. The way that malaria will affect the body is not the same way that the cancer will affect the body. Neither is it the same way that hepatitis will affect the person. So we discover again that different diseases have different effects on the body. So that is what we mean. All those changes, all those parameters that cause those changes is all encompassed in the pathology. Sometimes, in being able to understand pathology, we may have to examine different parts of the body. We may examine the body parts and tissues. For instance, we can examine the body fluid. Do you know that your blood can tell you a whole lot about you? Even your body tissues and cells can tell you a whole lot about you. Even the organs can tell you a lot about you. For instance, somebody comes to see a healthcare provider and they now do a scan or find out that the liver is enlarged. That liver is not supposed to be enlarged normally, but because the liver has changed and it has become bigger than normal, it's telling us that this organ of the liver that you're seeing that is enlarged, something is causing it. Something is causing it, and that if you want to find out what is causing it, then you may have to investigate. So pathologists have a role in determining the cause of disease. That is what we actually doing. What exactly causes the disease is what pathology. So summary of that side is that pathology is the study of disease, and then it is a bridge between science and medicine. Why I would say so is that medicine has to do with the treatment, while science gives us the reason why this person is sick. It's possible to know why this person is sick, and yet you cannot be able to treat it. But medicine can tell you this is the way to treat it. So what makes us to come into pathology is it is a dividing line. We know that this is how the sickness has started. This is what causes sickness. And then the medicine now will tell us this is how to treat this individual that has this sickness. So it is the dividing line, is the middle ground between science and medicine. And then it is actually the science behind the cure. What that will mean is that the science behind the cure is that you cannot know the cure until you know the problem. You cannot treat it until you know what you are treating. And the only way for you to know what you are treating is pathology, because it tells you what disease you are treating. Okay, let me give you another example again. Let me still go back to malaria. If you have somebody that has fever, the body is hot, the person is vomiting, the person is also having loss of appetite. Those three things, it can be in malaria, it can be in typhoid, it can be in hepatitis, it can be in many diseases. So the first question is that, so which one are we dealing with? Are we dealing with malaria? Are we dealing with hepatitis? Are we dealing with which one? So, but if you don't get the correct one that is the problem of these patients, you may be treating malaria, whereas the problem is not malaria. Or you may be treating hepatitis, the other one, the problem is not. So what we are saying is that for you to solve the riddle, which of these diseases is actually causing this problem, it is the knowledge of pathology that will answer to that. Okay, let me go further. Look at the example I just gave now. Malaria, typhoid, hepatitis, all of them are having loss of appetite. All of them are having fever. All of them are having, what was the other thing I mentioned? Headache. Let's put those three. So the question is, how do we know whether this is malaria or typhoid or hepatitis? Our knowledge of pathology will make us to say, okay, if we are suspecting that it is malaria, can we check for malaria in this person? If it is there, then we may say it's possible it's malaria. But if you do the test for malaria and it is not there, it means that most likely it may not be malaria. Then you remove your mind from malaria. So you are now left with two, typhoid and hepatitis. So you now go for hepatitis test. You do hepatitis screening. If the hepatitis B or C is positive, and then malaria was negative, hepatitis B or C is positive, you now know that this problem is most likely hepatitis, because the malaria test you did said it was negative, but the hepatitis test you did said it was positive. But you are now left with typhoid still hanging there. The same person, you now do typhoid test and the typhoid is saying is positive. So you now have two positives and one negative. The negative says malaria is not there, so you have removed your mind from malaria. The hepatitis say it is present. Typhoid say it is present. So you now have to dig deep between these two. Is it that the person is having the two conditions? That is he having both hepatitis and typhoid, or is it that one is a real problem? Let's find out which one is there. You now investigate further. By the time you investigate further using your pathology knowledge, your pathology. We are going to see later in the course of this lecture. We are going to do some tests and all those stuff like that. At the end of the day, you may arrive at a conclusion, which may be that at the end of the day, typhoid is still there, hepatitis is still there. That is a possibility. That means you can now say this person has both typhoid and hepatitis. Or if you take the test all to the end, and at the end of the day, all you are seeing is typhoid is negative at the end of the day, already your malaria was negative. Then now hepatitis is the only one that is positive. It means that your final diagnosis is hepatitis. So now you begin to treat. What are you going to treat? You are going to treat what your final diagnosis is. So you are not going to bother yourself about malaria. You're not going to bother yourself about typhoid, but you are going to bother yourself about the hepatitis, which you have come to know from your pathology test and knowledge that it is hepatitis. What I'm just saying here is very important. That is, it is so important because once a person misses the diagnosis, he begins to put the patient under pressure because the patient will not know what you are treating him for. That is one. Number two, the patient will be spending money unnecessarily. Treat this one today, treat this one tomorrow, treat the other one tomorrow. Number three, it will make the patient to lose confidence in the person that is treating him or her. He will know that this person doesn't know his work. Let me go and look for another person to treat. So by the time people start losing confidence in you because you didn't know what to do, that's a very big issue because over time, people will not come. That is why your knowledge of pathology is very important. In fact, among all the doctors in the world, if you are not sound, among all the health providers, if you are not sound, and what makes you sound is your pathology knowledge, because that is what makes you to say, it is this disease or the other disease. So we say it is the science behind the cure. Let me go to the next slide. So who is a pathologist actually? Who is actually a pathologist? In the contemporary English nomenclature, a doctor that is called a pathologist is a medical doctor who has, first of all, used 6 years of his life to train in the university as a medical doctor. He has gone to university. He has read medicine. It's 6 years. Then after that, that first 6 years is just a normal doctor. We call it MBBS, Bachelor of Medicine, Bachelor of Surgery. That is a normal doctor. You see, somebody has graduated from medical school, is a doctor. That is the first stage. But to become a pathologist, you now go back again for further training. That further training can take 6 years, it can take 8 years, it can take 10 years, because you are going to be writing exams, you are going to do a lot of practical, you are going to be attending to patients, and as you are doing that, the professors will now be examining you, giving you exam from time to time. You do that for 8 good years. Is when you pass all those tests, you pass all of them, you can now be called a pathologist. So actually it takes time. It takes time and it's energy demanding. And anybody that's a pathologist must have gone through a lot. And then when you come out, you are now a consultant pathologist. After that, it will take you some another 9 years or 10 years. You can become a professor of pathology. That is why professors of pathology, there are not many, because it takes time to reach that level. So the next slide says, who is a pathologist? They are actually specialist doctors that are behind the cure, because they are the one that will tell other doctors, you see this patient that you are treating, don't treat him again with what you are doing, because that is not his sickness. The sickness is this. With cancer. But has on the I say, this thing is cancer. They start treating. But you know which drug to bring? Drug. We have different cancers with different treatments. Now it is the pathologist now that will take a tissue from that swelling and take it under microscope to go and check what kind of cancer is this. At the end of checking it all, he might say, okay, this cancer is leiomyoma, this cancer is Burkitt's lymphoma, this cancer is a schwannoma, this cancer is this cancer is that. It is the name that he's calling that is a real correct answer, because he has been able to prove that that is the disease. So now, when he gets the correct diagnosis, it is at that time the managing doctor can say, okay, we are now going to treat for leiomyoma and not schwannoma. We are going to treat for this other cancer and not this other one. Why? Because the pathologist has been able to tell him from his diagnosis and test what the true diagnosis is. And this is important again because assuming the managing doctor does not know what he's treating, he will be giving the wrong drugs to the patient. And that is why the patient can be there 1 year, 2 years, nothing is changing. He can be there spending all his money and time. Even the doctor said will be looking frustrated because he's not giving cure to the patient. That is why we keep saying the specialists behind the cure are the pathologists. And truthfully, pathologists are very important. Till tomorrow, there is no hospital, there is no health provider that can do much without the pathologist. That is why we need to know what the disease is. So now, let me go to the next slide. It is considered a part of laboratory medicine with people of different specialties. And usually for a pathologist to make a diagnosis, they may take body fluids, such as the blood, urine, or even the cells to diagnose the specific disease. Modern medicine rely on modern medicine, that is the medicine of 21st century. They rely on the skills of pathologists to enable them to manage their patients. Number 3 information is that the pathologist must be very accurate and must be able to make reliable diagnosis, and he must do that quickly. So you see the terminology. His diagnosis must be accurate, it must be reliable, and must be quick. These are very important. If he's going to make the diagnosis and it has taken him 1 year to make the diagnosis, the patient will die now. So he has to work with speed. Number 2, he has to be accurate because anything he tells the other people, say this patient has cancer of the leg, assuming it's not cancer of the leg, he has deceived everybody, and that is what they are going to manage. So he must not make mistake. That is why pathologists are very careful doctors. They don't rush. They don't rush. They take their time and get the answer. The pathologist, in turn, relies on modern pathology laboratory that offers a wide spectrum of technology. Now, this pathologist does not do it all from his own brain. He relies on other people that work with him. That is why this medical work is actually a team work. You work with the medical lab scientists, you work with the biomedical, the medical officers, you work with the scientific officers, you work with the laboratory technician, you work with other people because it's a team work. It's a teamwork, and this we must emphasize that no one person is jack of all trades. The human body is very complex. Nobody knows it all. So if you see anybody that say I know it all, it's a lie. Because if, for instance, if you go online after this lecture, just go and check, for instance, textbook of the eye. You are going to see big textbook. As small as the eye is, people are still writing books about it because what God has created, man cannot discover it all. Every day we are discovering new things about the eye and other parts of the body. So even the pathologist is still learning alongside with us. That's why a teamwork is better off than individual. Let's go back to the history of pathology. Pathology did not start today. The early people that were traceable, the origin of pathology is traceable to Egypt, Rome, and Greece. That was in the early centuries of the beginning of civilization. And I want to quickly scan through some of the Greek people that did some work. There's a man called Galen. Okay, no, the very first man that was called Celsius. Look at this spelling, Celsius. Celsius.
At least
Celsius was a Roman personality. Celsius was a Roman citizen. He was the very first person to coin the word inflammation. And you know, inflammation is actually a medical term. Let me explain. If you hit your leg, maybe you're walking, you hit your leg on a stone. You see, it's very painful, right? Very painful. After some time, the place will swell. After some time, that place may be so painful that you'll not be able to touch it. That process of the swelling and the pain is called inflammation. The very first person that was able to say when a hard object hits another part of the body and there's going to be inflammation, it was this man called Celsius. So they began to find out what exactly causes inflammation as far as that early time of the beginning of civilization. After that, there was another man called Galen. He was an authority on anatomy. Anatomy is the study of human body. The head, the leg, the abdomen. How does the body arrange itself? Another person that did that was Galen. Then going further, there was the first doctor to do post-mortem dissection. What that means is people died. He's the one that opened up their body to find out what killed them. That is post-mortem dissection. The very first doctor that did that was Avezzoa. That was, you can see, it's 10th and 11th century. Very, very, very many years ago. We now come to this other man called Vesalius. He wrote a book on the Fabrica Corpora Humani, and this book was actually to find out what makes people to die. Why do people die? When they die, what is the cause of death? Is it sickness? And how does the sickness affect them? And so forth and so on. We now go further to other people like, so going further, we realize that at the early stage, the knowledge of pathology was only to describe what was happening. Oh, this person has inflammation, this person has swelling, but it did not give further information. But along the line, people began to go further. Let me come to this 19th century, which comes close to where we are now. In the last phase of the 19th century, people began to look at microbiological techniques. That is to say, they now brought microscope and check this thing that we are calling sickness. What exactly causes sickness? And by the knowledge of microscope, by involvement of microscope and knowledge of medicine, people were able to know that what we are calling disease has origin to some microorganisms that you cannot even see. Things like viruses, bacteria, protozoa, and fungi. And I'll give you an example. When a mosquito bites you, that thing that is going to cause malaria in your body, do you see it? You can't see it. But yet, at the end of the day, whether we are seeing it or not, we know that malaria will come in the person that has the mosquito bite if it was an infected mosquito. But the fact that you are not seeing it does not mean it will not happen. So that makes us to know that diseases are beyond the things we see with our naked eyes. That is the origin of medical practice that began to change. People saw that diseases and sickness were beyond the surface. It's not only the things you see that causes disease. There are some things you cannot see. For instance, if you put food, if you cook rice now, put it on the table. Don't warm it. Oh. Come back in 4 days' time. That rice is on the table. Oh. Try to see whether you can eat it. You discover that even you know that if you eat this rice, because it was left open for 4 days, bacteria must have grown on it. The question is, that bacteria, are you seeing it with your eyes? The answer is no. So how do you believe that it will cause disease? Even though you can't see it, if you carry that rice grain, put it under microscope and check, you're going to see a lot of bacteria. So what we are now seeing is that diseases can come from things we cannot see. Microorganisms. That is what changed medicine. And that is where the origin of infectious disease started. People started understanding infectious disease, that this thing is due to infection, infection, infection. That is the real meaning of infection, microorganism. Let's go further. Now, it is now apparent that all diseases reflect changes at molecular level. What that means that every disease we now see starts from what you cannot see. Even when they say this person has cancer, cancer does not come overnight. Malaria does not come because you are seeing the person. There is something happening in the blood that you can't see, but it's now causing a change in the symptoms, causing malaria symptoms. So it is now apparent that all diseases, they start at the molecular level. Molecular level means things you may not even see with your naked eyes. So, and that again makes us to say that as a consequence of this, studying cells, that is the human cells, and molecules involved in disease has become the cornerstone of modern pathology. This is where pathology is hanging its strength. If you study the changes in the cell and study small microorganisms, you can be able to know the cause of a disease. That is, this statement I've made is the hallmark of pathology. Everything you're seeing physically is traceable to very insignificant things you may not see. And that involves the use of molecular techniques. So molecular techniques have been used to make diagnosis. That is where you see things like microscope, you see things like ELISA and other stuff. So we have sophisticated method now available to study diseases and how they can cause problem. Pathology is as old as you can imagine, yet it is very modern medical discipline. So it doesn't get old. You can say that we trace it to the 10th and 11th century. Even still today, it's a very modern medical discipline, and it remains at the center of diagnostic medicine. That is why I said earlier that once you remove pathology, forget it. Whatever anybody is doing is just trial and error. It's trial and error, and the patient will suffer for it. That is why it is as old as you can imagine, but yet it is as modern as you can imagine. Next point. Okay. Well, we talked about some of the historical facts, Basisti, Mogani, and all that. We mentioned this. Let me look at it. Look at this. The second line on this slide. In the 19th century, people began to notice that most diseases were caused by infection. A particular man called Robert Koch and Louis Pasteur were at the top front. These are the people that discovered bacteria. These are the people that brought microscope into existence. These are the people that used microscope to see that diseases can be caused by microorganisms. Louis Pasteur and Robert Koch. That now means that the microscope was focused on samples of disease cells and tissues, and pathology came to resemble what it is today. They will take the blood of people, put it under microscope. They will see what the eyes cannot see. They will take even the saliva, put it under microscope. They will see what others cannot see. They will take any part of the body. That was the revolution of medicine, this microscope use. So with light microscope, it became possible to correlate the observed signs and symptoms in individual with the cellular changes. What that means is that by the time you're seeing the signs and symptoms in a person, the person has headache, he has fever, he has swelling this, he has that, he has that. You take his body parts, his body cells, his blood, urine, and all that. Check it under microscope. You're going to see something that will tell you why this person is having this complaint. Branches of pathology. Now, it's good to know that pathology is very wide, as in, is very, very wide. And because it is wide, sometimes people try to classify it on the age or the organ to name the kind of pathology, but this is more like a general nomenclature. Look at this. Some studies of pathology are determined by the age of the patient. If you're dealing with pathology of small children, we call it pediatric pathology because pediatric has to do with children. Anybody that is a child is less than 18 years. That is a child. Pathology of children is called pediatric pathology. Sometimes, if your orders related to the type of sample that they receive, if, for instance, the next one is called cytopathology. Cyto means cell. If the pathology you want to bring in is only about the cells of the person, so you call it cytopathology. This one, you're interested only about the person's cells, cytopathology. Then some other ways of classifying pathology depends on the method. If you're using a molecular method, you call it molecular pathology. Then some people go for that to say, okay, if you're studying the pathology of the liver, you call it liver pathology. If you're doing the pathology of the brain, you call it neuropathology. If it's a pathology of the intestine, the stomach, and all the abdominal organs, you call it gastro-related infertility or women-related pathology. We call it gynecological pathology and so on. But the truth is that most pathologies are all round. They are not limited to pediatric, they are not limited to molecular, they are not limited to cytopathology, they are not limited to liver, they are almost everywhere. So in most hospitals, pathologists tend to practice in all these special areas. Let's go to the next slide. So the other way of classifying pathology is from modern medicine classification. Here we say that pathology is divided into chemical pathology, which is also called clinical biochemistry. Another branch is hematology that has to do with the study of blood. We shall talk about this shortly. Then we talk about cellular pathology, which is having two branches, the histopathology and cytopathology. Then we have forensic. This forensic pathology is gaining weight because look at it, for instance. Somebody is in his house, is living alone. It's an old man. Nobody is there, no child, no relation. The man is alone. He has been living alone for like 10 years, no problem. But suddenly they wake up one day and discover that Baba is not coming out of his house. They knock the door, Baba is not there. They force the door open and see the man dead. The man is dead. They are wondering, what happened to this Baba that died like this? What would have been the problem? You are now going to trace the cause of death. And the whole process of tracing the cause of death that is apparently initially unknown, but later you can find out, is what we call forensic pathology. This is what we use in detecting people that you've heard of stories of all these Yahoo boys that killed young people. We can know how they killed their victims by forensic pathology and all that. Immunology is another branch, medical microbiology is another branch, and so on. Let me go to this is yet the most recent way of classifying pathology is this one in branches of pathology 3. This is where the world is now. We classify it as anatomic pathology, otherwise called morbid anatomy, and is divided into two: cytopathology and histopathology. Then we also have medical microbiology, medical microbiology and parasitology. Then we have hematology and blood transfusion medicine. Then we have chemical pathology and immunology. I will talk on this very fast so that we'll explain and know what this is all about. Let me start with this anatomic pathology. Anatomic pathology is a branch of pathology that deals with tissues and diagnosis of disease. Let me explain. A lot of patients that need this kind of pathology will require what we call biopsy. Biopsy means that we take a person's tissue and go and check it under microscope. A typical example is this. Somebody goes to the hospital, but before the person went, he has a very big neck swelling. There's a swelling on the neck. And now if you want to find out what is the cause of this swelling on the neck, there are many things that can cause swelling on the neck. But when he gets to the hospital, the doctor would take a small portion of that swelling and go and put it under microscope and check what is happening. He will now know that this thing is thyroid problem or is cancer or what is inflammation or whatever. The ability to get the ability to the ability to there's a background noise there. The ability to detect the cause of this swelling is where anatomic pathology comes in. And anatomic pathology basically relies on microscope. You've seen this microscope. The most common procedure is that they check the cells under microscope. So you can see this slide. You see this slide that is colored purple here. The doctors will put a tissue from the human body on this glass slide, prepare it, put some dyes, and then put the glass slide under microscope. From there, they can see exactly what is happening in the individual body. So the most common procedure used in making diagnosis in this condition of anatomic pathology is the use of microscope. It involves viewing microscopic slides from tissue sections. Sometimes we can do immunohistochemical studies. We put some things and check for other parameters. Sometimes we do cytology, but normally we must take a tissue from the body of the person. That is called biopsy. It may be total or complete, or total or incomplete. These are always view under the microscope. All their things has to do with microscope. Sometimes to avoid the issue of uncertainty, the microscope is connected to a television screen, as you're seeing here. So whatever they are seeing under the microscope is showing on a screen. So others that are not seeing the microscope, but they are in that environment, they can see what is being projected on the screen. So they can look at the screen and say, okay, look at these cells here. Look at these other cells. This one means this. This one means that. At the end of the day, they can come up with a final diagnosis. This is modern medicine. Very, very important. Now, look at this one. Whatever this woman is looking at, under microscope, that is a picture she's seeing there. It looks as if there's really nothing to pick from this image, but I can tell you there are a whole lot. Under here, you can see normal cells. Then you can see these red areas. These red areas, some of them are blood vessels. That means the blood vessels became thicker than normal. Some of them are inflamed areas. By the time the doctor, as a pathologist, sees all these things, he can come up with a diagnosis. just by looking at the microscope, he can come up with a diagnosis. So finally, the second part of anatomic pathology is that this is the other part, is called cytopathology. They put a smear of the cells on glass and then view it under my. All these blue pictures you're seeing, these are cells. If you see these pictures, you have some blue cells here. Then in between, you're seeing some brownish red cells. You see, these are different cells. So the blue cells are the abnormal cells. The other ones are the normal cells. So the question is, why are we having blue cells? That will make the pathologist to say this is the reason based on his knowledge of theory. And from there, he can make a diagnosis. So summary there, we say that anatomic pathology uses histopathology and cytology to make a diagnosis. But between the two, cytology is less diagnostic than histology. Let's go to the next one. And okay, anatomic pathology can make us to make diagnosis like cancer of the breast, cancer of the thyroid, and so forth and so forth and so forth. Then there's a difference here between cytology and histology. Both of them are method of anatomic pathology, but they are not the same. Like I said, cytology has to do with cells. Histology has to do with body organs or tissues. But at the end of the day, the whole essence is to make diagnosis. Let's look at the next branch of pathology is called chemical pathology. Like I said, it's also called clinical biochemistry or clinical chemistry or clinical pathology. They are all synonyms. They mean the same thing. The modern name for it is chemical pathology. So now in that place, in that area, this is a branch of medicine that studies the biochemical basis of disease, and it involves the use of body fluid like blood, urine to diagnose. For instance, somebody is in the hospital with a kidney problem. The kidney is inside his body, but if you take blood from that patient, that blood you have taken will tell you so much about the kidney problem the person has. You don't need to touch the kidney, just take the blood. That is why this area of medicine uses blood and body fluids to make a diagnosis. From the blood, you can make a diagnosis of hepatitis. From the blood, you can make a diagnosis of what was the other one I just mentioned? Kidney disease, liver diseases, and a whole lot just from the blood alone. It is so deep, this particular one, that almost everybody will need a chemical pathology test to be able to know what the disease is. That is why when the person goes to the doctor, say, okay, we have to do some tests to liver function test, renal function test, electrolyte, urea, creatinine. All those ones are telling you what is happening in the organ, even though you are using the body fluid. Their work, these people also is the bridge or the gap between laboratory and the clinic. They provide advice to other doctors. They interpret the results and tell doctors, is this disease or is not this disease? This is diabetes, this is not diabetes. This is cancer, is not cancer. This one is this is that. So this is all encompassed in chemical pathology. What are the functions actually? They analyze their functions involve analyzing body fluid. We just mentioned that they analyze the blood, the urine, and other fluid to measure substances like electrolyte, hormones. Okay, let me talk about these hormones. The lady, a typical example is this. Here is a lady, she's 20 years, she's married. Let's use 25. She's 25 years of marriage. There's no child. And she's worried. What's going on? And then she goes to the hospital. They say, okay, let's do the hormones. The people that are going to be involved in the hormonal test is the chemical pathologists. There's a way the hormones of the female go. There's a pattern that is normal. There's a pattern that is abnormal. One, there is an alteration in the hormones. It causes hormonal imbalance, and that can lead to infertility. We've treated a lot of them over and over. Now, let me give a very small example. This lady is 25 years. She's not pregnant. She's not breastfeeding, but she notices that there is breast milk coming from her breast. The breast milk is plenty. And then she checks it. Why is breast milk coming out of the breast milk? But she's not pregnant. In fact, she can't even get pregnant because what is happening there, that one of the hormones of the body, which is called prolactin, is very high. And as long as prolactin is high, she cannot ovulate. And as long as she cannot ovulate, she cannot be pregnant. So as simple as that breast milk is coming out, It looks as if it's not a problem, but it's a big problem which has to be handled. But then she can never know that until she has to do hormonal tests. That is why, again, I'm talking about hormonal tests is traceable to chemical pathologists and so on and so forth. So there are many examples. Just at the time for this lecture, or this lecture has to cover a particular area, but as we go on with time, we'll be able to explain a whole lot. This is just an overview. The next thing is what they do is to diagnose diseases. Of course, chemical pathology that can diagnose diseases like diabetes, liver disease, kidney disease. Okay, let me give another example here for diabetes. If you take a bottle of Coke, it increases the blood sugar. Another person takes a bottle of Coke, it increases the blood sugar. But the question is, so what increase of blood sugar can we say is diabetes? Is it any value? The answer is no. In modern medicine says that if somebody has an increase in blood sugar in the morning, he has not eaten, and it's up to 7 millimoles per liter. You repeat it again, it's saying 7 and above. You repeat it, saying glucose, that is high, maybe 6.22. You have seen that these are two different values. One is 7 and above, while the other one is 7.2. So the question is, which of these two persons is actually diabetic, or which of them has diabetes? Again, you cannot stick out your neck to say this one is diabetes or not. It's the knowledge of the chemical part, because they will tell you anyone that is 7 and above is diabetes. Anyone that is less than 7 is not diabetes. So, but you cannot know until the chemical pathologist comes in to interpret the result. That's why part of the assignment is to interpret laboratory result and tell you what this result means. Because if you get a result from a lab, it's not everybody that can interpret that result. And of course, again, wrong interpretation of that result leads to wrong diagnosis. You can see again why these people are very important. The monitor treatment. The monitor treatment. If somebody has a disease and is being treated, how do you know whether there's a good response? The person is getting better. Apart from the person telling you, I am getting better, the real way to know the person is getting better is by monitoring by the chemical pathology, because they are going to be checking some things in the body. Is it increasing? Is it decreasing? Is it normal? For instance, let me give a typical example. Somebody has cancer of the prostate. They do PSA. PSA is 1,000 millimoles per liter. They begin to treat the person. They begin to treat the person, and they ask the man, Baba, how do you feel? Baba is saying, I'm getting better. Baba is talking from his mouth, but the doctor will have to do some tests and check PSA again. Maybe you have treated that man for 1 month, 2 months. You check the PSA level. If the man is getting better, the PSA level is supposed to be dropping. Initially, it was 100. Maybe now it's 70. It drops to 60, drops to 30, 20, 10. Even you, at the time it's dropping to 10, you look at the patient is far better. You now know that, yes, apart from the patient's confession that is getting better, your test and your result is telling you that this man is getting better. So you monitor the treatment by tracking some of this thing. So those are the this thing. So the chemical pathologists integrate between science and medicine. We talk about they have diagnostic support. We mentioned that earlier. They also do clinical consultation. They run clinics. Yes, we run clinics to see, especially on metabolic problems like obesity, bone diseases, endocrine issues. Like I just mentioned to you, a lot of related infertility patients have been managed again and again. If I remember one man, that man was an Igbo man. He was a big trader. He had plenty money. He was into big time business, but he was about to marry. We couldn't just have a child. He brought a wife. We had to say, okay, let's do the hormonal test. We checked it. We saw where the abnormalities were. We corrected it. The man had, I think, 3 children now. Very happily married. But you can't manage him if you don't know what the problem is. You can't manage him satisfactorily. And he was so glad. As we speak, he's still in touch because of the good outcome. So sometimes for chemical pathology, they can manage diabetic condition where the glucose value is very high. They can manage liver function, liver issues. They can also give, attention to cancer related. Yeah, I just mentioned that about the cancer of the prostate. This is a standard chemical pathology laboratory. Most times it is using a big machine like this, automated. You put a blood sample like this. This is National Hospital Abuja. This place is National Hospital Abuja. Puts the blood sample into the machine, After 20 minutes, 10 minutes or so, the result comes out. That is how the result that comes out, the doctor now uses the result to manage the patient. Now look at this. This is still like, this one is outside the country, one of the big laboratories outside. You can see these sample bottles. Some are blue, some are orange, some are red. They mean different things. These bottles are not going to be used for the same test. Different tests use different bottles. Another day we'll talk about sample bottles in chemical pathology if need be. Now, some of the tests that can be, okay, some of those bottles, for instance, this one was color blue, which is lithium heparin bottle. It can be used to measure things for liver function tests, kidney function tests. So if you're going to do tests of liver and kidney, you're going to pick this blue container bottle. You cannot put it in this yellow one. This yellow one is fluoride oxalate. It's specifically for glucose. You cannot also go and put glucose in this other one. Then this one is plain bottle with red container. That means there's nothing to, it's usually used for lipids and other things. So this is very important because if you put the blood sample in the wrong bottle, you're going to get a wrong result. This is very, very, very important. Very, very important. So what are some of the basic tests in chemical pathology? You can do electrolyte like sodium, potassium. You can do enzymes. You can check calcium, magnesium. Okay, there's this other case I saw about 2 weeks ago. The boy is 2 years. He's having bow leg. He's going to 3 years. He's still having bow leg. The parents were worried and called my attention. I said, okay, this child needs calcium for growth. Let's check his calcium level to find out whether this is the reason why the bow leg is existing. Bow leg, when he's walking, it's as if the leg is bending and all that. So we check his calcium, check his vitamin D, and in some places we can even check the magnesium. We want to see, does this boy need calcium in his diet? Does he need vitamin D in the diet? These are some of the tests in chemical pathology. So machines that are used majorly in chemical pathology include this ELISA machine and the spectrophotometer machine. This is what most chemical pathologists use in their lab to get the result. Now, this is hematology. Hematology is the branch of pathology that has to do with blood. Blood is very complex. You see this blood that we see, red fluid in the body of an individual. When you take it under microscope, this is what you are going to see. These shapes is like a small circle, small circle, small circle. You see, this is blood. Doctors that specialize in blood are called hematologists. So pathologists that are, so we have hematopathologist, a doctor that is a pathologist that deals with blood. So I said it here that human blood is very complex fluid. As small as you're seeing that red fluid, it can tell you a whole lot about the individual. Now, hematologists work in laboratories. They also diagnose, they treat and manage patients, but strictly on blood disorders. Example of blood disorder is sickle cell. Example, sickle cell. Anyway, I will just give a word or two with that with time. Another example, another example is leukemia. Leukemia is cancer of the blood. Have you observed before? Somebody has a wound. Somebody has a wound. The blood stops after some time. Another person has the same wound. The blood does not stop. Have you ever observed that before? That is telling you that there's something about the blood. One person is normal. The other person has a blood problem. That is why the blood is not a small wound. The person will be bleeding for 1 minute, 2 minutes, 5 minutes, 10 minutes, 20 minutes, it's still bleeding. It is the hematologists that tell us exactly what is happening. And they do some what we call coagulation test to see why is this person. Another common problem with another common problem that hematologists handle is anemia. Anemia is when blood level is low. Blood level can be so low, the person will feel dizzy, easily tired, and can even go into heart failure. So some bleeding problems can occur. People cannot be able to arrest bleeding when it occurs, and that is where it can kill. That is why the hematologists look at blood cancers, leukemia, I've mentioned them, then lymphomas, multiple myeloma, all these ones are cancers of the blood. Then we have things like hemoglobinopathy. Example is sickle cell. Have you ever seen a sickle cell patient before? What you are seeing as a sickle cell patient is not a problem of the bone, it's a problem of the blood at the molecular level. That is why we say modern medicine told us that every sickness starts from the molecular level. That is one of the major ones, is this sickle cell. So at the end of the day, all what you're seeing is coming from the blood. can say, hey, let me show you what happened. So look at this picture. Look at this picture. On my left is the normal red blood cells. Have you seen? Red shape, round, 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 otherwise called it biconcave. But look at the ones of sickle cell. This one of sickle cell is like a star. Have you seen? It's like banana peel. You've seen it. Sickle is straight. What happened is that inside the blood vessel, the arteries and vein, these normal ones can easily pass. They can pass easily and move on. So blood can pass here to the brain, to the legs, everywhere. But this other one that is sickle, when it's trying to pass, it will get blocked. It will get stuck. When it gets stuck, that means blood cannot pass to the front of it. And once blood cannot reach the distal end, it can cause problem for the patient. So most of the symptoms sickle cell patients have is because of the sickling of the red blood cells. This small thing you're seeing is what makes the whole difference in them. Sometimes they can go into crisis, sickle cell crisis. They can even die if care is not taken. That's why we tell them, take a lot of water, drink a lot of water, because we know that when they take a lot of water, these sickle cells can easily pass. But if there's dehydration, it may be difficult to pass. We always tell sickle cell patients, take a lot of water. That's one common way to help them. Now, what are the tests that hematologists normally do? Normally, the common one is full blood count. Full blood count is also called complete blood counts. Other ones are blood film. In this blood film, they take a blood, spread it on the glass slide, check it under microscope. You may be seeing some abnormals. Even the shape of the cell can tell you what the disease is. The next one is coagulation test. This one, they want to know, why is this patient bleeding and why is this other one not bleeding? Why is it taking so long a time for this patient to bleed and the other one is not? The bone marrow biopsy tells you what is happening inside. The blood that we all have is coming from the bone. I hope you know that blood is formed in the bone. So before it even comes out of the bone, some studies can tell you what is happening in the bone marrow, so that if there's a problem there, you can start intervening before the blood comes out into the blood vessel. This is an advanced medicine. You can see that hematologists also use microscope. You can see this is hematologists using microscope. Let me summarize hematology. This is the origin of the modern day medicine. There was a man called Karl Landsteiner. Karl Landsteiner is the one that told us that blood is not the same for everybody. Blood is not the same for everybody. You can have the same brother, the same sister, the same, that they don't have the same blood group, because what they inherit may be the different thing. Individuals have different blood. So it was this man, Karl Landsteiner, that started the blood grouping system. He told us that blood group can be blood group A, blood group B, blood group AB, and blood group O. That is the man that gave us that knowledge. This man changed the course of modern medicine. That is why he's also a pathologist. So the next point is medical microbiology. Medical microbiology is another aspect of pathology. This one, remember I mentioned that some diseases are caused by bacteria, virus, fungi, and all that. Again, you cannot see them with your eyes. So it is the medical microbiology that use their knowledge and microscope to see what others cannot see. Things like malaria parasite, things like typhoid, things like bacteria, which we can't see. It is the medical microbiology that tells us what they can see. A short history there. In 1676, bacteria and microorganisms were seen by this man for the very first time, Anton van Leeuwenhoek. He discovered microscope and checked some things under it. He's the first man that saw some things under microscope. Much later, Edward Jenner is the first person that immunized a child against smallpox. What he did was that he put the bacteria that causes smallpox, he injected it into a small child. What the body will do is that since the body has sent that the bacteria has entered the body, it will mount up immunity to protect that child. So that was the origin of immunization, which is still used till tomorrow. You know, children have immunization given to them, right? The person that started it was this pathologist, Edward Jenner. He's the one that came up with this. Much later again, Louis Pasteur discovered vaccines based on the principle of Edward Jenner. And so Joseph Lister is considered the father of antiseptic surgery. Is because infection can kill, even when you are not seeing it. Yes. Imagine somebody has a wound on the leg. He puts sand on the wound. His death enters the wound. He's not seeing the microorganisms on top of that wound. Before you know it, that man can have tetanus and that man can die. So infection is a killer. And if you notice, okay, I'm coming back to that. So it was this man again, Hans Christian Gram, who told us that bacteria can be checked, and then you can also know whether it is gram positive or gram negative by the principle of gram stain. Till tomorrow, they are still checking using gram stain in modern medicine. Then it was Paul Ehrlich that told us about some things about syphilis. Syphilis is a sickness, but it was traceable to this man. This man too found out that what was causing syphilis was some microorganisms called the spirochetes. 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 You can't see with the eye, but he discovered it. Now, this is the hallmark of microbiology. In 1929, there was a man called Alexander Fleming. Just before this man was the one that discovered the first useful antibiotics, because antibiotics kill bacteria. That time, before this man discovered antibiotic, people used to die a lot from infection. Pneumonia, they would die. Typhoid, they would die. This one, they would die, because there was no antibiotics. There was none. It was, and of course, look at the year 1929. But just before this 1929 was 1914, 1915, First World War. Many people that were soldiers that went to war, they had gunshot injury. Many of them died. The reason why they died was not because of even the gunshot. It was the infection that came as a result of the gunshot. So now, 1929, Alexander Fleming discovered the first antibiotic. And the first antibiotic he discovered was called penicillin. Till tomorrow, penicillin is still in the market. It is this penicillin that was a wonderful drug. Many people started taking penicillin, and infection reduced drastically. That is why till tomorrow, if you talk of antibiotics, this man, Alexander Fleming, his name rings out. After, go online and check about him. He discovered penicillin. He was from Scotland, and he discovered it by mistake. That's another interesting story for another day. So, and so on and so forth. He got a Nobel Prize for medicine that year. So, in summary, the medical microbiology, they do tests that has to do with chlamydia, streptococcal organisms, typhoid, tuberculosis, sometimes viral diseases, candidiasis, these are even ringworm. All these ones are problems of ill health, and this is traceable to medical microbiology. Even malaria, cardiac hepatitis, HIV, those are microbiology problems. You know, what is the role of pathology in modern medicine now? I think I'm about to do a summary. Pathology remains central to modern medicine because it provides the correct diagnosis. It guides the doctor in treatment and helps us to manage disease. It identifies the nature of disease and tells us exactly is the unsung hero of modern medicine. It is the unseen force that guides the diagnosis, the treatment, and research. And then we can say that in summary, it enables us to diagnose the patient's condition and tell us how it is so serious. Is it stage 1, 2, or 3? That is the staging. It helps us to monitor a disease when you're treating. It helps us to manage the condition. It can be used for research and also enhancing public health knowledge. And then evolution of pathology. Like I told you, pathology is as old as you can imagine, but it's as new as you can be. So there is technological advancement. It does not mean that it has come to the climax, it has stopped. No. Every day, new things are coming up in pathology to be able to make patient diagnosis to be very, very easy. One of the things we must know, as I'm talking to you now, people can check people's blood glucose without even taking their blood. That is an advanced level of pathology. I saw that in one of the countries and it was really amazing. So it is an evolving course. It keeps changing. Good, better, best, and so forth. So in conclusion, we can say that pathology is a branch of medical science primarily concerned with the study of disease, the cause of disease, the nature of disease, the origin of disease, and is actually the cornerstone of modern medicine. So thank you very much. I think I can end it there. Thank you.
Thank you, Prof.
Yes. I hope you followed it to the very end, right? Yeah, you can unmute yourselves.
Yes,
You can unmute yourselves. Good. Yeah, so do you understand the much you could understand? I won't say do you understand everything, the much you could, as much as you could. You did, right?
Yes, sir.
sir.
Thank you
Thank you
so
very
much,
much, sir.
sir. Very enlightening.
You
For
did.
so
Good
enlightening, sir.
Very good
Okay.
introduction. Some things I never heard before.
Okay.
Thank you so much, sir. Yes, sir.
Yeah, it's my pleasure. My
Look forward
pleasure.
to it.
So
Yeah.
again, let me give you the audience. If you have questions, you can please feel free and ask, okay? I'm here to answer your questions by God's grace.
So I have a question. Biochemistry class, the teacher was saying that the biochemistry we are doing is clinical biochemistry. So now you just told us now that it's still chemical, same thing with chemical pathology. So I'm wondering where's the difference? Thank you, sir.
Yeah. Okay, the dividing line, right? Yes, you are correct. The teacher is also correct. Now, let me say that clinical biochemistry or chemical pathology is used interchangeably. But if you're doing it just as a theory and you're not in the hospital setting, or they're just trying to make you to know that this biochemistry has to do with health-related issues, at that level, they call it clinical biochemistry. But if you're now dealing with patients, and you're now going to take their blood to check what is happening in the blood, and you're checking their biochemical parameters, it's still clinical biochemistry, no doubt, because that's an advanced form of what they taught you. But again, it is actually a disease condition that is causing that, so we call it chemical pathology. That's why the usage is interchange. So if you use it, this for that or this for that, it can go. Now, but let me say that if you notice, because the biochemistry teacher is not dealing with patient, he will prefer to call it clinical biochemistry. But at a higher level, we can call it clinical biochemistry or chemical pathology, because we're dealing with both the normal and the abnormal. But your teacher is dealing with basically the normal. That is why it's strictly tying it down to the usage of clinical biochemistry. But they are basically the same thing, just nomenclature usage.
Thank you for your clarification, sir.
I hope that is clear, right?
Yes, sir. Thank you for the clarification, sir. Thank you so much, sir.
Okay,
Thank you,
so
sir.
yeah, more questions. More question. Adeze, Abdul Baki, Amidat, I'm waiting for your question. So, Peter, yes, Karim, Olu, Stephanie Young, I'm waiting for your questions. Kifaya, are you there? Aisha, Chidi, Chidima, Ebere. All of you ask if there is. So if there is, but if there's none, I think we can call it. We allow the provost to make his remarks, then we can now proceed from there. So is the provost with us online here? Hello, provost. Yeah, you can unmute yourself, sir, and then you can talk to us. Hello, Dr. Lawale. Sheshwambe. Shengbomi, sir. Okay, somebody should please reach him. One person should reach him online so that he can make his comments or remark, then we can actually call it a day. Stephanie Young, Nurat, all of you, I hope you're hearing me. Or mute yourself so and then talk.
Yes,
If
sir. I
there
can
is.
hear you clearly, sir.
I hear you.
Yeah, Stephanie, you're hearing me. Adeze, Abdul Baki, Chidima, Amidat.
I can hear you. The
All right.
lecture was
Okay, so please,
actually
somebody
nice.
should.
Can hear you, sir.
Yes. Okay,
Okay,
that's good. That's good. Thanks so much for the. What do you say? Please come again. I didn't hear you.
I said I've called him. He's coming, sir.
Yes, please come again. I didn't hear. Okay, all right, okay. You've called him. He's coming, right? Okay, it's fine. So while he's coming, let me do an overview. What we just did. We're trying to talk about pathology overview and basic things that are necessary to know. When it's around, let me know, please. The origin of pathology, the name, the meaning of that word, the origin, Greek word pathos and logos. We mentioned the definition of the terms. We went further to what it is, study of disease, generally. So even if you don't get so much, just know that pathology is the study of diseases. Then, of course, we say that pathologists are the specialists behind the cure. Who is a pathologist? First, I say it's a medical doctor. Then he goes, which he has read medicine for 6 years. Then he goes again for another 6 to 8 years. That makes 14 years. Then he goes again for another 9 to 10 years. That makes him a professor of pathology, of course. So you see, when someone is saying he's a pathologist and is a professor, of course, that person must have spent a whole lot of his time reading. Modern medicine relies on pathologists to make diagnosis. We mentioned that historical perspective went back to the origin, the first man Celsius, and tracing down to contemporary medicine. That pathology is as old as you can imagine, but it's as modern as you can imagine as well. It is the center of diagnostic medicine in the current 21st century medical practice. Then we also, of course, we trace it to the branches. Yeah, the branches, many ways to classify the branches, but the most useful way now is this one. This is so pathology we can see is divided into 4. That's what we are now concluding. We talk about this. The anatomy pathologies that has to do with microscope used to make a diagnosis. Anatomy pathologies there. We talked about the slides. We now went further to talk about the chemical pathologist. We now went further to talk about, of course, this is National Hospital, like I mentioned to you, automated machines. Machine does most of the tests. Some of these machines can run up to 1,000 tests in 1 hour. Human beings cannot do that. That's why automation is taking a toll on laboratory, on practice. If you have a big hospital that has thousands of patients, you cannot be doing manual work. You have to do machines. You put the blood, it will give you your result in less than 1 hour. This is still an extension of it. I told you that the bottles are not used the same way, different bottles, different uses. Talk about the various tests of chemical pathology and the machines, hepatology, those that are into blood. And we now went for this is sickle cells. Blood under microscope can show different pictures. And then we now went on to say a blood group. This man revolutionized blood group. It was the one that told us that blood groups have 4 types now. And everybody that's listening to this presentation, if you check your blood group, it's either you are A or B or A, B or O. The person that taught us all that is this man, Karl Landsteiner. Then this next slide tells you if you're O, you can take blood from O, but you cannot take from. See this other one mark XX, you can't take from them. Anywhere green, you can take blood from them for those that do blood transfusion. Medical microbiology has to do with the microorganisms. We mentioned that we traced it historically. Then we now talk about the evolution of pathology and concluded. I think that is it. Thank you so much. Is Provost on ground now?
So I said we should give him
Hello, sir.
1 minute.
Oh, okay. Am I sure he's there? Okay, 1 minute, Abby. All right.
Yes, sir, 1 minute.
Who is talking, please?
The classroom, sir.
Who is talking? Adeze, right?
Yes,
No,
sir.
Adeze, tell us one thing you have learned while we're waiting for him for 1 minute. Just one thing.
Okay, sir. I learned a lot on hematology. How we can actually tell people that patients to take more water. It helps with their blood passage due to their sickly blood red blood cells.
Yes, that is very good. Very, very good. And that is exactly what we tell the sickle cell patient, because usually when they start having crisis, and this crisis, there are about 4 of them: vaso-occlusive, sequestration, and so forth. This crisis can be so painful. You see, there are pains. That pain, paracetamol does not handle it well. They need to be under very strong pain relievers. But to avoid all those problems of crisis, we normally tell them, take a lot of water, whether you're thirsty or not, just be taking, because the more water you take, the more your blood can become more than someone that the blood is thick. That is why we tell them to take a lot of water. Sickle cell patients suffer a lot, and that's why we give them all the support. Apart from that, we tell them to take their blood tablet. Normal blood tablet for them most time is folic acid. We don't allow them to take iron containing drugs because it will cause too much iron in their body. That can cause another problem. Drugs like Astifa, we'll never encourage them to take Astifa. We'll not encourage them to take ferrous sulfate or any of those stuff because those ones have a lot of iron. But for any normal person, you can actually take them without problems. Amidat Alawode, say something. Amidat. Amidat, is Amidat there or not? Peter.
Yes, I'm here, sir. Thanks so
Is
much for
Peter
the
there?
class, sir.
Who is talking? Amidat.
I mean that.
Oh yeah, over to you. I'm hearing you. Started well. Continue.
Yeah, thank you so
Amidat,
much for the
yes.
class. So one of the things
Yeah.
I
Good
can
afternoon.
pinpoint out what I learned from is more on the hematology,
Yes.
when it talks about the different the color of each for blood tests.
Those bottles, those sample bottles, right?
Yes,
Yes,
sir. Yes,
those
sir.
sample bottles.
Sorry, sir.
Yes.
Sorry, sir. Sorry, sir.
Yes.
The collecting is in class now.
Yeah. 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 So now those sample bottles are very important. And this one, we must know it from the very beginning because I will tell you why. If you put blood sample, for instance, somebody is a kidney patient, has a kidney problem, you take his blood sample, excuse me, take his blood sample, you put it into that yellow container or another container. It's going to increase some of the values of what you are looking for. So instead of seeing normal value, you're going to see high, and it will give you a false diagnosis that can make the doctor to treat the patient wrongly, and that patient would die. That is why we must be very careful. Any sample you're collecting, you must put it in the right bottle so that it will now be done the right way. Okay, I think that's good. Mr. Peter, I wanted to say something before the provost will come and say something conclusion-wise.
I know there's
Mr.
nothing. I
Peter
just wanted
Ochu,
to say that it was
are you
nice.
there?
Yeah, I'm there. I'm only saying that it's been a nice class.
Okay.
Yeah, it's been very, yeah.
Okay, thank you so much.
In fact,
Thank
I
you
was
so
curious
much.
about.
Thank you
I
so
was
much.
curious.
I'm
I was
grateful.
curious about the sickle cell stuff, so I'm really happy I had that.
Okay, that is fine. Thank you very much. Thank you
Good
very much.
afternoon, Prof.
Yes, yes. So,
Prof,
okay,
sir.
I greet you. Yes, sir. Good afternoon, sir. I greet you.
Good afternoon.
Yes,
Sorry, I've been away.
I know you are a
How's
big
been the
man.
class?
Yes, the class. Ask them. They will be the one to answer the question. But I think so far they are all very happy. they have learned a lot. And we simplified it to make it simple.
Okay, that's
Yes.
great. That's great.
Yes, sir.
So thank you so much, Prof. And I think we are going to. The only thing is that I think from next class maybe we can have a complete syllabus of what they will be learning in this semester. I think that's the next thing
Yes,
we have
it's
to
better.
do. Yeah, so
Okay.
so thank you so much. So
All
I'm still
right.
going to ask them one by
Okay.
one about today's
Yes.
class. So, but I know that
Exactly.
today's class would have been so so interesting and educating.
Exactly. It's well. Thank you so
Yes.
much,
Thank you
Provost.
so
I'm
much.
grateful.
Yeah. Are they still in
Okay.
class?
All right. Bye.
Hello.
I think
okay, they're still in class. Bye bye.
I can log out now. Yeah.
Yes.
I can log out now.
Yes.
Okay, thank you very much. I'm grateful. Bye.
Yeah, no problem. Yeah. Bye bye.
Thank you, Lord.
Okay. Good afternoon, everybody.
Good afternoon, sir.
Yeah.